So in terms of medical interventions, it's good for the team to plan clearly for the day ahead as the investigations procedures which are needed together, so we can adjust the timing of the tests that are done. It doesn't need to be done by the night shift staff before the handover, so it can be done by the day team as well. If there is a test like a drug level which is due in the afternoon, you can postpone the electrolyte levels to the afternoon. The TPN can be adjusted based on the blood gas, or you can modify the TPN up to a certain period of time during the day. Think about every test you're ordering and have some meaning. If you are having a bone profile on a certain day, don't do the metabolic profile on a different day. Try to club them together so you don't need to repeat the tests. Avoid ordering the tests which are having no clear indication or benefit. Stool calprotectin is an example where we don't know how to deal with it. Same with the clotting factors in a very premature baby. Unless there is a need for intervention, don't do it routinely. And remember that every blood sample saved is going to reduce the number of transfusions that are given. As I said before, avoid protocol-based testing. Have a basic protocol in place as to the number of days you want to have blood tests in, so you don't miss out on tests, and keep noting that down in your plan so you can have a test done as suitable. It's important to titrate the number of blood gases based on the clinical condition. So don't keep a set order. If a baby is on high frequency, you need it every 6 hours. If the baby is unconventional, you need it every 12 hours and so on. So titrate it. If you use other parameters like the end-tidal carbon dioxide pulse oximeter, and if you have the transcutaneous carbon dioxide, it's useful as well. If you need a repeat blood culture planned, combine it with the cannula change, because these babies need cannula regularly for a duration of antibiotics, and it's much easier to draw the blood culture through a cannula and time it with that, because if 1 or 2 days delay is not going to matter in these cases. You just want to confirm that the culture is clearing before you stop the antibiotics. And try to combine the blood tests and blood gas with blood glucose monitoring unless either one of them is urgent. Show the presence of mind and take samples with cannula change. Suppose you have a sample planned for the morning, but you have a cannula change at midnight. You don't need to prick again in the morning. So take the sample a few hours earlier. Most of the medical team is going to understand this approach, and you can make it clear when you discuss with each other that this is the reason this has been done. So there is no need for misunderstanding or fear of what will happen if the test isn't done at a certain time. So you also know, and that's why educating the nurses and empowering them is important, that they know why a test is being done, whether there is flexibility in the timing and so on. So the end-tidal carbon dioxide is a simple device, and you can get the carbon dioxide reading. It doesn't correlate exactly, but same as a transcutaneous bilirubin, it gives you a trend, and using the trend along with the saturation, you may be able to avoid. All that we need is to know the baby's ventilation is stable, and you don't need to repeat a blood gas immediately. And that information can be obtained from this.